And this is a demo on tonic and sedation points. So the sedation point on the lung is lung 5. It's on the radial side of the elbow crease, radial side of the bicep tendon. The bicep, the big muscle in the arm. It's on the radial side. Just unwinding that. Why would you do this? To calm the lungs, asthma, that can't breathe, the wheezing, those type things. Calm the lungs so they can relax. So it's going towards the thumb, going towards the chest, going towards the thumb, going towards the chest, towards the thumb, towards the chest. So that's the sedation point. If the cranial rhythm, the inner physician says do the sedation point for the lungs, you would do that. The tonic point is lung 9. It's the radial, the radius, side of the wrist crease and the dip on the lateral side of the radial artery. So it's on the outside there. And that's going down, I should say up. Now it's coming down towards the thumb, up towards the chest. So if you want to tonify the lungs, that's for the people who are having trouble breathing at all, where they just have weak lungs for just chronic obstructive pulmonary disorder or other things, bronchitis, pneumonia. This is where you want to tonify the lungs. Get going. Going up to the chest, down to the thumb, up to the chest, down to the thumb, chest, down to the thumb, up to the chest, down to the thumb, and then large intestine 2, the sedation point, is on the medial corner of the index finger, the second finger, distal to the metacarpal phalangeal joint at the junction of the red and white skin on the second finger. So large intestine 2 is to calm the intestines so that running piglet chi or running diarrhea or very active bowels, you want to calm the bowels down. So large intestine 2 going towards the tip of the finger, going up towards the nose, going down towards the tip of the finger, up towards the nose, down towards the tip of the finger, up towards the nose. So that one's moving well. Large intestine 11 is the tonic point for the large intestine. It also releases the sacrum, remember. It's at the lateral end of the elbow crease in the depression anterior to the epicondyle of the humerus. You'll feel the humerus there. You'll feel the bone underneath it. It's at the thumb side and the radial end of the elbow crease. So to tonify the large intestine, those people with chronic constipation, they can't digest thoughts or ideas. Also, if they have chronic constipation, they can't get rid of things, so have them look around their house and see if they need to do a little house cleaning and get rid of stuff. Large intestine 11, the tonic point, going up towards the chest, down towards the thumb, down up towards the chest, down towards the thumb, up towards the chest, and nose, down the thumb. So that's moving well. Stomach 41 is the tonic point for the stomach. It's at the ankle crease, between the tendons of the hallucis longus and the exterior digitorum longus. If you wiggle your big toe and second toe between those two tendons on that ankle crease, is where stomach 41 is the tonic point for the stomach. Helps nausea, helps digestion. So I'll just go down there and unwind that. Stomach 41. Going towards the second toe. Going up towards the eye. Going down towards the second toe. Going towards the eye. Going towards the toe, second toe. Towards the eye. So you wouldn't particularly do all of these on anybody, but you would do them as needed. So stomach 41, the stomach 45, the end point on the stomach meridian is at the lateral corner of the second toenail, I believe. Stomach 45, lateral corner of the second toe, 0.1 cm posterior to the corner of the nail. So you want to just unwind that. That's to calm the stomach. Somebody who's got stomach kind of imbalances where everything's gurgling around, esophageal reflux. Going towards the toe, turning around, coming up towards the eye, going towards the toe, up towards the eye, down towards the toe, and that's moving very well. Next will come the spleen 2. It's on the medial corner of the big toe. It's distal and inferior to the first metatarsal digital joint where the red and white skin meet. So spleen 1 is at the tip of the big toe. Spleen 2 is distal to the knuckle on the first toe. So spleen 2 is the tonic point for the spleen. You remember the same organs that digest your food, digest thoughts, ideas, emotions, and experiences, going down towards the toe, coming up towards the head. So somebody who's not digesting ideas, who can't comprehend, who can't concentrate, you might unwind their spleen meridian and then see if it needs any tonic or sedation. So that's spleen 2, coming up, going down to the toe, going up, coming down. And then one more, spleen 5 is distal and inferior to the medial malleolus, in the depression midway between the tip of the medial malleolus and the tuberosity of the navicular bone. This is good for hemorrhoids, stops excessive thought, the brain drain. It also stops premature labor, so that could be useful. Spleen 5, so that is distal and inferior to the medial malleolus, midway between the tip of the medial malleolus and the tuberosity of the navicular bone. It's going up, coming down, going up, coming down, going up. And then for fun, let's do the heart. Heart 7, the sedation point to calm the heart, is on the wrist crease at the end. It's in the depression on the radial side, thumb side, of the tendon of the flexor carpi ulnaris, between the pisiform, the little bone there, and the ulna, the bone on the little finger side. So heart 7 to calm the heart, calms the spirit, calms the emotions. Heart 7, good to do before bed. Or if somebody's really cranked up, you can calm their heart, going towards the little finger, going up towards the armpit, comes back towards the little finger, up towards the armpit, back towards the little finger. That's good. And then heart 9, the tonic point for the heart, is on the medial tip of the little finger, 0.1 cm posterior to the medial corner of the nail. You might remember that's the exit point. Heart 9, coming to the tip, going back up, going to the tip, going back up to the armpit, coming to the tip of the little finger, back up. So this is to keep the heart in shape, to tonify the heart, to keep it healthy. For hypertension, you could ask, does it need to be tonified or sedated, or it's something else? That's good. Okay. And then practice.